Over the last couple of decades, we've seen the health of kids go backwards, not just in Australia and in Victoria, but around the world.
A lot of what we heard in our workshops was that there was not a lot of physical activity happening for young people. Screen time had increased. So I guess for us, it was around how do we work together to get kids out and about and get them physically active.
Respond is a large project across northeastern Victoria, funded by the National Health and Medical Research Council, with the key emphasis being on helping communities to improve the health of kids in their region.
We've always known that rural and regional kids have poorer health outcomes than our metropolitan counterparts. So the Respond project has actually been able to give us some concrete evidence to say, well, in actual fact, that's right.
We built a monitoring program that was relatively low budget, where communities helped us collect information on the health of their kids. And that information was about sleep, diet, activity, but also mental health and physical well-being, and also how does the community work? How do we work together? What resources do we have? How can we use those to optimise the response to improve the health of kids?
So I think working with Deakin has given us some really tangible tools to be able to introduce systems-based thinking and make it real and meaningful for the community, and how they can then take action to make change.
We develop tools working with the community where the first question is, what do those tools need to look like? And so a big part of that has been developing software that allows communities to understand the complexities, see it for themselves, and use it as a part of the design and the response. And so that software is called Sticky, which stands for Systems Thinking and Community Knowledge Exchange.
The Deakin University team have actually provided us with a whole series of resources and skills and expertise that we didn't have before. So having access to something like Sticky has actually enabled us to develop a map around health and wellbeing of our kids in our region. But it's also given us another opportunity to be able to use that software and this approach for solving other complex issues.
The community have told us that they wanted to engage with nature, so we have some park walks and water walks happening. They also identified that they needed a one-stop shop to get health information and resources to undertake activities. There was also identified that the cost of things was a bit of a barrier for young people to be involved in, and also that young people wanted not necessarily to be physically active in a competitive way, but that they could also be physically active in non-competitive ways.
When we think about the reach of Respond, it's working in 12 local government authorities in northeastern Victoria, and it reaches about 45,000 kids. And we see somewhere between 20 and 100 separate activities happening in each of these communities that impacts the health of children. And if we look across Respond, we've seen measured improvements in the mental health of kids, measured as psychosocial health, in the physical well-being of kids, and across a whole range of behaviours. How do we make the things that have worked in Respond work everywhere? How do we make healthy normal? And the way that we do that is we build a workforce that's trained in using these techniques and that has the support and the backing to go and do this work in their communities. Our communities can solve this problem if we support them to do it.